It's a very lovely 47-year-old woman who I've met before, and we've worked together before. About 2 years ago, she had a gastric sleeve procedure, which is a bariatric procedure. Lost a tremendous amount of weight. Last I saw, about 107 pounds.
117.
117! She's shrinking. Anyway, that's an incredible amount of weight, especially for somebody your height. Obviously, that's related to proportions, but not uncommonly when people lose that much weight, they have hanging skin. And as she will tell you during our initial consultation, I typically have people who've lost that much weight and have complaints about the skin just to prioritize. Top to bottom, what bothers you most, what bothers you least, and it's usually a list. Top of the list tends to be trunk or abdomen area. Many women complain about the breast. You've been happy with that part, so we haven't done anything there, but that's usually in the top 3. Arms, thighs, and sometimes facial aging. There are other areas too where people have hanging skin. Sometimes people have what we call the upper back roll in some other areas, but that tends to be less common. At any rate, at least in my practice, I split these up. I like to keep these procedures less than 6 hours of operative time. I like to keep them in an outpatient setting. I don't want to do anything that's going to be such a difficult recovery that you can't walk, that you can't actively participate in your recovery. I find that when we do that, or when surgeons do that, sometimes it puts you at risk for some complications that we want to try to avoid, like blood clots and pneumonia. So I want people to be walking that day, walking the next day. As much of a slog and struggle as it is, you'll do it. So Sue here is a great example of that. We met, she had numerous complaints. I said we should start here and focus on what we feel is going to address your top concerns first, safely. And then now we're getting into stage 2, which is where we're going to address some other concerns. So today, biggest concern, I think, would you like to say what your biggest concerns are?
Well, initially I thought it was going to be my neck because of the wrinkling from shrinking, but it moved to my thighs because I look disproportionate now.
Yeah.
My thighs, have always been big, but now since the rest of me is smaller, my thighs just stand out tremendously, especially in clothes. And then I have these little pooches, little saddlebags or whatever, that I hope can be a little smoothed.
Right.
So my priorities moved.
Right. And I know I'm the one talking at the camera here, so I don't know if you all heard what she said, but we did on stage 1, we did a fleur-de-lis lower body lift, so a circumferential scar to elevate the hips and buttock, to pull the tummy tight, tighten the muscles, and then we also did arms. But things change, proportions change, and things that may not have bothered you as much initially bother you more later because you're fitting into clothes differently, finding yourself in situations where you may or may not be more interested in treating other things. So that is what we're here to talk about today. This is the kind of care you get here. We put you on a pedestal. Literally.
You're the only people on the pedestal.
You deserve it. On round 1, before we get to our exam, I just want to prep the viewers about on round 1, we did a fleur-de-lis lower body lift. That's a scar that goes 360 degrees around the body, also a vertical scar to treat the excess, especially the vertical scar is especially good at treating the excess between the breast or rib cage and the belly button, the upper abdomen. We also did arms, and we're not going to focus too much on that. We're focusing on our thigh exam today, but I just wanted to at least prep our viewers so if you see scars, you know what that's from. Ready?
Ready.
All right. We're just going to take your gown off here. And, all right, and I'm going to set this down here. And, one of the things I like about, we are 4 months out now. Right. Yeah. Scars are still a little bit pink, but they look great. Of course, the lower abdominal scar is down here in your panty line, and it looks really nice. But a flat tummy, a waist, I mean, just a really nice waist all the way around. I'm very pleased with that.
Me too.
But you still have your thighs, and like you said, oftentimes when we change proportions in one part of the body, it affects how we see or feel about other parts of our body. So now we're focusing on the thighs. This part, of course, is the outer thigh. We are going to do some liposuction to reduce this area and just help with your silhouette a little bit there. On the inner thighs, and if you would spread your feet just a little bit, or at least there we go. There are two issues going on. There's a little bit of fat there, but primarily we're dealing with skin excess on the inner thighs. That's because inner thighs tend to have this sort of crepey skin, and it's normal. Everybody has it to some degree. And what we want to do is to create a nice taper. To do that, we're going to get rid of the excess in this direction, but also get rid of the excess in this direction because you have excess in both. Down here, from here down, very nice, and that's not always the case. Sue here just has a very nice taper to her leg from here down. We will address this area on the inner part of her knee with a little bit of liposuction, but I can draw out or show you guys. So our patient's getting dressed, and she's going to be on to the next thing. I think she's got to go to work today. But at any rate, I just wanted to draw a quick illustration just to show what type of thigh lift that I recommend for her. Not everyone is shaped the same, and not everyone has the same problem. Some people have more fat. Some people have more skin excess. Sometimes it's inner thighs that seem to be the problem. Sometimes outer thighs. I really like to preserve fat on the waist. I say the waist, the hips. When we can, especially for women. That's a feminizing feature. We want around the hips, but when we see what we call saddlebags or fat concentrations of fat on the upper thigh, especially upper outer thigh, we want to address that. In her case, she has enough skin elasticity there that we're just going to use liposuction to remove the fat. On the inner thigh, there's going to be skin excess after we do liposuction. So there are different scar patterns. And I don't know if you follow me here, and this is the crease. The crease where the thigh meets your body, it's your groin, and so this is a great place to hide scars on a thigh lift. Unfortunately, when we do a horizontal only scar, which is what we call this type of thigh lift, it only addresses the crepey skin on the upper part of the thigh. Once you get crepey and skin excess on the middle third of the thigh, you're looking at a different scar pattern to address that. And certainly when you have, we see people that have lost tremendous amount of weight and have skin excess all the way down to, and in some cases below their knee, that's going to be more dependent on a vertical scar to take out that excess. So what we do in the case that we just saw here is take out skin in this direction. And when we close it, we bring this point to this point to this point, and it closes like a T. And the T is oriented so that this top part is in the groin crease. This vertical part of the scar is oriented right on the medial or inner part of the thigh to minimize visibility. In her case, she had a very nice shape to her leg, especially from the lower third of her thigh down. We are going to do some liposuction to treat or feather these areas and help the contour there. I typically do liposuction also of the inner and or the anterior, the front of the thigh and the back of the thigh to again facilitate shape and get those legs as good looking as we can. But that's the scar pattern I recommend for this particular patient. We call that a T-scar thigh lift.